Hello friends, welcome back to one of the most amazing lecture of Zone of Med, that is the scalp. So in today's video we are going to touch every important points from the topic scalp, as you are requesting me to post this topic, so I thought to make it. Now moving forward with this, what things we are going to see, that is the layer of scalp, the importance of each layer of the scalp, then we move forward the clinical significance of each and every layer, and that's it. So before starting, do not forget to like the video, subscribe the channel, and yes, share with your friends as much as possible so they also get benefit of such videos, because sharing is caring. Now starting with that, let's make the base of our scalp. Now we say that scalp consists of a soft tissue layer. First thing we see that if this is our head part, okay, I hope I'm good at drawing. This portion is our scalp, okay. So in scalp, this here where we have this hairs of this man, this part is the soft tissue layer and we consider it as the scalp. Now moving forward, we have 5 layers of scalp. Yes, the 5 layers are S, C, A, L, P. Now let's give them the name and each layer's significance. S stands for skin. C stands for connective tissue. A stands for aponeurotic layer. L stands for loose connective tissue and P stands for periosteum. So we name them. When we name them, now another step of it is its clinical significance. So we say in this 5 layers that there is the two groups in the sense there are group of 3 best friends and there are group of 2 best friends. So we say there are the group of 3 best friends and these best friends are S, C and A. So we consider these 3 as the one unit. We consider it as the 3 friends as one unit, and there is single L and P. L is most important when we talk about the scalp, that is loose connective tissue is one of the most important layer of the scalp, and the P is also important, but most important is L, that is loose connective, and second is connective tissue layer, which we also known as the subcutaneous tissue or the close network of subcutaneous tissues. Now when we talk about its clinical significance, we say it is important. Skin contain many sebaceous glands and that results in our sebaceous cyst. First clinical significance of this we have done. Second is the connective tissue layer. Connective tissue layer is concerned with our profuse bleeding. When we say that layer L is very important, how it is important? It is important because it is the danger area of scalp plus black eye clinical significance, plus it also forms safety valve hematoma. So we say how it is important and we have mentioned all the things. Important thing to note, that is one unit important, first clinical significance, profuse bleeding second clinical significance, and loose connective, that is danger area, black eye, safety valve hematoma clinical significance. We have covered entire base. So here we are, that is scalp is the soft tissue covering that covers our cranial vault soft tissue covering. Done with this. First, second, third layer forms as the one unit. See already. Fourth layer, that is loose connective tissue, which is also known as loose subaponeurotic tissue. It has the clinical significance of danger area plus clinic of black eye plus safety valve hematoma. Then we see skin is concerned with our sebaceous cyst, or we say the sebaceous glands are present in abundance, therefore it result in the formation of sebaceous cyst. And then the C, that is connective tissue layer, is concerned with our profuse bleeding. And last and finally, this pericranium part is concerned with our cephalo or hydrocele or caput succedaneum. Here it's not periosteum, it's pericranium. Make it correction, it is pericranium. So we have touched the entire important topics over here itself. The most two differences which we need, or the examiner might ask, that is, we mentioned that there is two anomaly, that is cephalo hydrocele plus there is another, that is caput succedaneum. Okay, so when we differentiate between these two, we say that there is a difference between these two anomalies. What is that? This hydrocele is seen in the children's, whereas it is seen in the caput succedaneum is seen in the newborn baby. First difference. Second difference, in this condition there is the swelling under scalp that contain cerebrospinal fluid, whereas in this there is a temporary swelling in this portion. So here we have completed the difference between the two. So this complete slide is done. Moving forward, we see how there is the, as I say that the fourth layer is very important. Now we see how this fourth layer is important to us. Before starting with this, we see what are the emissary veins. When we read your textbook, you come across with this vein. So this vein forms a connection between extracranial venous sinus and intracranial venous sinus. So in this, the connection or the connecting link or the communicating vein which help them to communicate between extracranial venous sinus and intracranial venous sinuses, extracranial venous system and intracranial venous system, that is the connection, and that connection is known as the emissary vein. So it's important, is only this much which we need to remember when we are talking about this particular thing. So here we have done with emissary veins. Here you see that this part is our extracranial vein, this blue one is our emissary veins, and here we have the cranial bone. So it is basically connecting between this part and this part. Another thing, we say we are done with emissary veins, how it communicates between them. Now we see if there is an infection in our subaponeurotic space. Suppose this is our subaponeurotic space and here we have this infection, okay? And this infection leads to the accumulation of pus over here. If there is the accumulation of the pus, that may spread rapidly into our intracranial sinuses, since we say that there is the emissary veins form the connection. This is our emissary veins that forms the connection. So we say this emissary veins, because of these veins, this infection gets spread here, that spread readily into our intracranial sinuses, and hence this layer is known as, this phenomena is known as danger area of scalp. So we are so much clear. First we see what are the emissary veins, that is the connection between our extracranial venous system and the intracranial venous system. Then we say that there is the subaponeurotic spaces where there is the formation of the pus takes place, or if there is an infection that leads into formation of this pus, and due to this connection that is formed by the emissary veins between the two, these infection can go in this layer, that is intracranial sinuses, and therefore we say that is known as the danger area of scalp. So we have done with this phenomena, that is danger area of scalp. We see what are emissary veins, we see why we call it as the danger area of the scalp, that is the infection spread rapidly. Why? Because there is a connection between emissary veins, that emissary veins is acting as the communication between the two, and therefore infection spread very rapidly into an intracranial part, and it causes the danger area of the scalp, and it is related to our fourth part. So we have done with this part. Second, we come to another part, that is the black eye. Here you see this, don't say it is the dark circles. The lady with the dark circle is different, the lady with the black eye. If someone punch you, see this boy get punched very hard, so this blue eye is known as the black eye. Now we see how it is taking place. When we talk about this syndrome, that how the blue eye is coming, so it is related to our fourth layer, we already discussed when we start this lecture. So if there is the, suppose this is the layer, and there is the collection of the blood, someone pinches you so hard, and in the layer you get the blood accumulated, this blood get accumulated in our fourth layer. Which layer is this? It is fourth layer, okay, and our blood get accumulated in this, that produces the swelling, which we term as generalized swelling, we say. So if someone punch you so badly, and in the fourth layer there is the accumulation of the blood takes place, and there is the generalized swelling that affects our complete skull, and the blood slowly, this blood, like here we have the, I guess these are the beautiful eyes, okay, so these blood get coming down slowly over here. Why? Because there is the accumulation of the blood, and the blood needs to come downwards over here in our, this part is known as a frontal part, okay, frontal belly, or we say it is also frontalis of our occipitofrontalis muscles, okay. So we say if this blood come very slowly at the part of our beautiful eyelids, and due to gravity this blood is coming down very slowly, so this, our frontal part consists of the muscle that is known as occipitofrontalis muscle, which has no bony attachment anteriorly, and this phenomena therefore results in the black eye part. So the points to remember over here is very simple. First is in our frontal valley we have occipitofrontalis muscle which has no bony attachment, basically anteriorly. Do not forget this point, it is very important because occipitofrontalis muscle has attachment posteriorly but there is no bony attachment anteriorly, so do not forget this thing. And since it has no bony attachment frontally, so it results in the black eye. So we are done with this black eye, that is fluid plus blood get accumulated in the fourth layer. Why? Because if someone punch you very badly and there is the generalized swelling but the blood cannot pass. Here we say that the blood cannot through our occipitotemporal region and the blood get transmitted therefore very slowly to the eyelids, and because the frontalis muscle have no bony attachment, it leads to the formation of hematoma, that is discoloration of the skin around the eye, and it leads to the black eye. Here it is a complete description of this as well. So we have mentioned in the previous slide that is there is the safety valve hematoma, and that is also the anomaly related to our fourth layer, and that is very easy. That is the blood from the intracranial hemorrhages normally communicate with our subaponeurotic space of the scalp, and that compresses and that do not develop until the aponeurotic space is full of the blood, and that results into the safety valve hematoma. But the most important thing is this black eye over here. So remember, in this black eye, the thing which we are concerned is this temporal bone and occipital bone. So remember the location of these two bones very thoroughly. Now we have already done with this part, that is cephalohydrocele, which is seen in the children, and the caput succedaneum, which is seen in the newborn baby. So we are done with the fourth layer, and it is the only part which you need to remember. Another thing I'd like to mention over here, that we say that emissary veins is important. So we classify veins into extracranial veins, emissary veins, and the diploic veins. So here we have done with the second layer, or sorry, fourth layer completely. Now we see how this last and final, that is the second layer, is important. So second layer is important because it contains abundance of our bloods and vessels. So our second layer consists of the blood and vessels as well as the nerve supply of the scalp, and the walls are very adherent to the fibrous network. So whenever there is the torn in our vessels, there forms the open wound, and that normally unable to retract, and it produces the profuse bleeding. So it results in the profuse bleeding, and it is corrected by the stitching. So this thing it is a minor scalp injury. There is the bleeding and it can be prevented by pressure against the underlying bone. So only this much you need to learn in this. When we talk about the profuse bleeding, the important thing which we need to remember is that the profuse bleeding is due to high vascularity. Why high vascularity? Because there is the high large nerves and blood supply is present in our second layer. It comes in the MCQ very easily. Clinical significance is profuse bleeding, and it forms the wound, which is also known as subcutaneous hemorrhages, and in this layer there is much less swelling as well as pain, whereas in the fourth layer there is the swelling, or there is the more swelling and less pain. So this point is also important. This layer heals very rapidly. Why? Because it is in close contact with the skin, and bleeding can be arrested by applying pressure, and therefore we can easily go with the stitching also. So that is the thing which we need to remember. Now we come with the nerve supply and blood supply. When we say that the blood supply of the scalp, we say there are the 5 set of the arteries that supply the blood, first in front and then the behind. In front we have 3, for front we have 3, and behind we have 2. In front we have, here I have marked in 2 sides, that is supratrochlear nerve, supraorbital nerve, and the superior temporal artery. So this is important over here. Whereas in the down we have the posterior auricular, that is the branch of our extra carotid artery, or you can say the facial nerve supply over here, and then we have the occipital artery over here. So let's see what are the sensory supply and what are the motor supply. When we talk about the sensory supply, I have already mentioned that supratrochlear and supraorbital are the branch of ophthalmic division of the trigeminal nerve. Trigeminal nerve has 3 division, in which the ophthalmic division has again 2 division, that is supratrochlear and supraorbital. Then we have the zygomaticotemporal branch. This is the zygomatic branch of maxillary nerve. Then we have the auricular branch of mandibular division of trigeminal. Since I say there is the 3 division of trigeminal nerve, so here we cover with mandible and here we cover with ophthalmic division as well. When we talk behind the supply, we say it is posterior auricular branch, then there is lesser occipital nerve, then we have the greater occipital nerve, and the third occipital nerve, that is C2 dorsal ramus nerve. Now when we talk about the motor supply, so motor supply is very easy to remember. At above we have the temporal branch of the facial nerve, and behind we have the posterior auricular branch of facial nerve. This chart is perfect for you to understand the supply of nerve. If you want detail of it, if you want detail of each layer, I have mentioned in my complete detail notes you want, so you can ping me on the Telegram and you can get more information about that, what all topics are going to cover in that detailed notes. So this thing you need to memorize by heart, nothing more to mug up in this. It is completely best for you to understand. In the nerve supply of the scalp, you need to remember only 10 nerves by heart, and nothing, that is 10 nerves that supplies the scalp on each side. 5 we say in front and 5 there is in behind. So 5 in front, 5 in behind, and we are done with this topic very easily. So guys, thanks you for watching with patience. If you like this video, so do not forget to like the video as well as put your reviews in the comment section.